Hi everyone. Today, a very good evening to all. Today, we again are going to see a letter, an OG letter, which is written to the family doctor. So the patient's name is Marilyn Johnson. Uh, you can say that, who are you? You are the ward nurse working in the obstetric units of Old Town Hospital. And your patient name is Marilyn Johnson, who came to your ward with abdominal pain and vaginal pain. Now let's see the writing task. Using the information given in the case notes, write a discharge letter to Dr. Hindley, Mrs. Johnson's family doctor. So Dr. Hindley is Mrs. Johnson's family doctor. So Dr. Hindley should know the family history of Mrs. Johnson, who all are there, what is her profession, husband's profession, her medical condition, her family's medical condition. Not only hers, her family complete. So definitely Mrs. Johnson's family doctor is Dr. Sarah Hindley. She knows everything up to the point where you have taken care of the patient till the discharge. So that's it. We need to select some relevant data from the case notes. Let's see what all these things. Be very selective. Name we need, age we need, address we don't need. We don't need the social background at all. Family history. The doctor knows what these things are. You know that ovarian cancer, all these things are known to the family doctor. Past medical history. No, we don't need. Yes, the admission date is 26/2019. Needed. Discharge date, yeah, maybe. Presenting problems, here we do have how she presented with the abdominal pain and vaginal bleeding, okay, along with some minor problems. Peritoneal guarding is another thing. So abdominal pain is the significant thing, hypogastric pain, vaginal bleeding, these two things. You can see that these things are highlighted here, abdominal pain and vaginal bleeding. That's the thing here. We don't need to address all the things, some associated problems. Now there is a fall in the BP and she's pregnant 8 weeks, but no scan performed yet. HCG is abnormal. It is very low compared to around 7,000. When a lady is pregnant by 8 weeks, 2 months, her HCG should go high. And right now it's low. And the diagnosis here is ruptured tubal ectopic pregnancy. Yeah. Now, this is the thing here. Ruptured tubal ectopic pregnancy. So on the day of admission, so 20th, she came here. Transvaginal ultrasound, empty uterine cavity, visualize nothing there in the uterine cavity. You can see free fluid pouch in the Douglas. So we conducted suspecting something. So when we have free fluid pouch in Douglas and empty Ukraine cavity, and we know that she's 8 weeks pregnant, then you'll be suspecting this ectopic pregnancy. Go with this diagnostic confirmation. Now she went with the diagnostic confirmation, that's laparoscopy. You can see when we visualize, we have found that hemoperitoneum and leaking left tubal pregnancy. Yeah. So a left self-injectomy was performed through this region, ampullary region. You can see that the collateral tube is healthy, the other side tube is healthy, and the lavage is then the things are washed out from the peritoneum, and we made it clean. The pressure is relieved from the peritoneal cavity so that we can prevent the peritoneal guarding. Now, wound dressing, cleaning done, progress good, vitals normal. Diclofenac as a painkiller. And now patient very anxious to start a new pregnancy. Query counseling, patient advice, these things. Education regarding contraceptive measures to 3 months or 2 menstrual cycles before pregnancy. Then high-risk future pregnancies. If happens, we need to monitor the HCG levels, ultrasound scans to verify the location of the embryo. Need to go with the folic acid supplements. All these advice is given to the patient right now. We are moving ahead with the 21st June. That's today's date. Dr. Sarah Hindley, fresh from surgery. Yes, Dr. Hindley, name is there. Reference, Mrs. Marilyn Johnson, age 27. Yes, correct. Purpose. I am writing to update you. Family doctor, that's why update you. The present health status of Mrs. Marilyn Johnson. Good. Okay. She's recovering after a left self-injectomy and is extremely anxious regarding conceiving in future. So 2 conditions we highlighted. What is the present health condition? She is recovering after left self-injectomy and is extremely anxious regarding conceiving future. One is physical, another one is mental. So this is the health status of Mrs. Marilyn Johnson. Updation to the family doctor. Don't need to write anything here. No further care management after this thing. As it is not given anything here, we don't need to do all these things. No, nothing is given. What we need to say, updating this thing. Yeah. Now, Ms. Johnson was brought to our ward with abdominal pain and vaginal bleeding yesterday. Today's date is 20. Today's date is 21. Yesterday's date is 20. So it is connected as we can say 21 connected. She was extremely tired and had a fall in BP. So what was the BP? She was tired. There was hypotension, abdominal pain, vaginal bleeding. Being 8 weeks pregnant. So it is not 8 weeks pregnant, 8 weeks pregnant. Okay. Her HCG level was marked abnormal at 1800 international units per liter. So this is something which we found abnormal. Later, a transvaginal ultrasound was done, which revealed an empty uterine cavity and a free fluid pouch of Douglas, which indicated ectopic pregnancy. So we did further investigation after assessing the HCG level as abnormal. We have seen the ultrasound, transvaginal ultrasound, which revealed an empty uterine cavity and a free fluid pouch of Douglas, which indicated an ectopic pregnancy. A diagnostic laparoscopy followed. So next thing following that, following ultrasound, we did a diagnostic laparoscopy. So what we have done, a diagnostic laparoscopy followed, which confirmed left tubal pregnancy and hemoperitoneuria. So we have said, number one, the finding was abnormal HCG. Then we have seen an empty uterine cavity. Then you have seen a free fluid pouch. Then we have seen laparoscopy, confirmed left tubal pregnancy and hemoperitoneuria. So I've written left tubal pregnancy and hemoperitoneuria. Therefore, the aforementioned surgical procedure was performed along with peritoneal lavage. So the intervention is also clear. Now, one last look at here. Okay, leaking left tubal pregnancy. So I can say that it's here, confirmed. Ruptured left tubal pregnancy. The diagnosis as it is, I have to give ruptured tubal ectopic pregnancy. That's it. And hemoperitoneuria. So the paragraph, this is the crucial paragraph. We need to give this information to the doctor. So we have given this to the doctor. Information. After she was brought to our hospital ward, these were all the things, investigations and procedure with that. Now, what about after the procedure? After the procedure, this is the thing here. So we can say that Mrs. Johnson is recovering well after the procedure. Now I can say it is, wait a minute. Mr. Johnson is seen recovering well. After the procedure, is seen or was seen, it's a problem. It's easy because right now we can see Johnson is seen recovering well after the procedure. You can see that, yes. Good prognosis. So in order to avoid this confusion, the tense confusion, what you have say, Mr. Johnson's prognosis was well after the procedure. Now, Mrs. Johnson's post surgical progress was good and her vitals are stable now. Good. Her wound is cleaned, dressing was done, and was advised to have diclofenac in case of any pain. Mrs. Johnson's post-surgical progress was good and her vitals are stable now. Her wound is cleaned. Yes, wound was cleaned. Dressing was done and was advised to have diclofenac in case of any pain. Education was given to her over regarding the high risks if she don't wait for at least 2 months. Now I have to use another word there, provided that. That is a formal way of using instead of if. Education was given to her regarding the high risk. If. So instead of using if, I have used provided that becomes formal there, provided that she would not wait for at least 2 months for another pregnancy. So education is given to her regarding the high risks. If she would not wait for at least 2 months for another pregnancy, if she is not waiting for at least 3 months, so it was 3 months, not 2 months, it is 3 months. I think it is 3 months there. Wait 3 months, yeah, it's 3 months for another pregnancy. She was also made aware of the screening and care if she conceives in future. The screening means HCG, ultrasound, verification of location of embryo, and the care is folic acid supplements. So we are not going to say all these things. We are summarizing it there. Yes, she was also made aware of these things. However, she appears to be over anxious regarding the same. So whatever the thing is right now, patient is very anxious to start a new pregnancy. So what the doctor has to do? It would be appreciated if you could assess her physical and mental status, because she underwent procedure, surgical procedure. She need to assess, so family doctor has to assess the physical status and the mental status because she has over anxiety after the discharge. So today, the discharge is after the discharge today, and provide her counseling is if necessary. So we have said the discharge is today and provide her counseling is if necessary. In case of any further queries, please don't hesitate to contact me. Yours sincerely, Ward Nurse, Obstetric Clinics, Old Town Hospital. The problem is solved. This is the letter which we focused on the procedure, the test, the diagnostic test, the procedure, and the care and education which we have given to the client at the hospital. Whatever happened in the hospital is highlighted. And what you need, or in yellow, what you need to do is highlighted in blue. The purpose is not highlighted there. Thank you, one and all.